Dilated cardiomyopathy is a condition where the heart doesn't work properly. The muscle is weakened, it becomes enlarged, and the heart doesn't pump enough blood to meet the body's needs. This can be due to a variety of different causes. In familial dilated cardiomyopathy, multiple family members are affected. In that situation, we think it's most likely that the cause is going to be genetic. Familial dilated cardiomyopathy is diagnosed first by characterizing the disease in the patient. This is done with the usual kinds of testing that include physical examination, echocardiograms, electrocardiograms. In addition, attention has to be paid to the rest of the family. Testing there might include a careful family history, screening of other family members, and perhaps genetic testing, depending upon how the information develops. Familial dilated cardiomyopathy is different from other forms of dilated cardiomyopathy in important ways. It's very important in familial dilated cardiomyopathy that we think about every family member. In addition to that, the treatment may be somewhat different for the individual. Depending upon the cause of dilated cardiomyopathy, there may be important differences in the kind of treatments that your doctor recommends. When a person is diagnosed with dilated cardiomyopathy, there should be consideration to whether other family members might have the disease. That diagnosis and the search in other family members should be different depending upon what the first patient is. For example, if the first patient is a child with dilated cardiomyopathy, that's a rare disease, and in that situation, a very thorough search should be made for all of the other family members, because there's a reasonably high likelihood that that will be familial dilated cardiomyopathy. On the other hand, if the first patient is an older patient who has other explanations for the disease, it's still appropriate to consider whether it might be familial DCM, but the search might not be as extensive. The value of genetic testing for dilated cardiomyopathy is something that's changing very rapidly, and the answer today is probably going to be different than the answer in a year. Right now, the most obvious benefit from genetic testing is to determine which other family members are at risk for developing the disease. This can allow better planning of medical care and diagnostic testing, and allow us to be more focused in terms of specific recommendations to family members. As time goes by and we accumulate more information about genetic dilated cardiomyopathies, it's probably the case that treatments will tend to vary depending upon the genetic cause, but that's not so much true today.